Yeah, good afternoon, good evening, everyone. This is Dr. Ganasai Krishna. I'm working in Chandray Rheumatology and Immunology Center, Bangalore. As there is a Rheumatology Awareness Month going on, I will be telling you about when to consult a rheumatologist. So basically, I'll be telling what is the branch rheumatology. Rheumatology is a branch which deals with the rheumatic diseases. Are the rheumatic diseases are the diseases which involve the joints, muscles, and cartilages, mainly causing joint pains, swelling, and stiffness in the joints, leading to deformities. This is basically what is a rheumatic disease. So basically, rheumatology is the branch which deals with the rheumatic diseases. So I'll be highlighting more here on when to consult a rheumatologist and what are the benefits of consulting a rheumatologist in the earliest possible by recognizing the signs and symptoms. So the basic signs and symptoms include one is the joint pains, which are persistent joint pains, which are associated with any swelling in the joints or any deformities in the joints. We have to just notice them. If you notice any persistent joint pains with any deformities in the joints, that is the one symptom, and other symptom being any persistent muscle pains, or you have any persistent low back pain, or any rashes on your body, any unexplained weight loss, any unexplained fevers which are low grade continuing since many days. These are all the warning symptoms which will warrant you to meet a rheumatologist. If is it it is necessary to meet the rheumatologist at the earliest possible to make sure that the disease is diagnosed in a right way and the treatment is started in the earliest possible, as we can halt the immune process, which is the autoimmune process which is going in that patient. And so the treatment will be given for a shorter duration of time if the patient approaches earlier, rather than if the patient comes in the later part of the time. So approaching earliest would make the physician or the rheumatologist to treat him well in advance, so that the disease process will not be going in a progressive way. So we try to halt the disease process in the initial stage itself, so that he'll be cured of the symptoms soon, and we can slowly taper the immunosuppressants what we are giving. So this is the basic importance of why we have to visit the rheumatologist at the earliest and uh, watch for the and start the treatment part. So basically, the common rheumatic conditions include, one will be a rheumatoid arthritis, which is a symmetrical polyarthritis, which mainly basically involves the small joints of your hand and feet. It basically involves any of the joints, but its predominant involvement will be of the small joints of the hands and feet. So this is basically rheumatoid arthritis. And other form of arthritis is osteoarthritis, which is a very common form of arthritis seen in a majority of the population, which is due to wear and tear in the joints. It is a degenerative condition seen mostly in the older age people and postmenopausal females. So this is basically osteoarthritis. So another thing is lupus. We'll call it as SLE. It is a chronic autoimmune disease which will affect your skin, your joints, and it can also affect other organs, including your lungs, kidney, based on it is specifically different in one person where it gets involved. So it has organ system manifestations also. So this is basically about SLE. And these are all the common rheumatic diseases what we see in the daily practice. So this SLE predominantly affects the female population more rather than the male population. And another form of arthritis is gout, which is an acute inflammatory monoarthritis, which usually involves the first MTP joint of the feet. So it occurs usually due to the metabolism. It occurs mainly due to the problem of metabolism with the uric acid, where we'll see the deposition of urate crystals in the joint, leading to the severe pain in the joint and severe tenderness in the joint and severe redness in the joint. It is usually seen in one joint itself mostly. So that is gout. And other forms of connective tissue diseases include, which are less common, are scleroderma. This is also a chronic autoimmune disease which will cause fibrosis of the skin, and it also has other organ system manifestations, including the lungs, and other organ system manifestations are also there, which is known as scleroderma. The other disease we would like to talk about is vasculitis. So vasculitis is nothing but it causes the inflammation in the blood vessels. So we have basically three types of blood vessels: small blood vessels, medium sized blood vessels, and large sized blood vessels. Based on that, it is categorized differently. So these are all basically the main common rheumatic diseases and some uncommon rheumatic diseases. So what are all the signs and symptoms of these rheumatic diseases? I'll be telling you in detail. One is the joint pain, which is persisting joint pain since many days, which is not being recovered with the medications available over the counter. Then you need to visit a rheumatologist. This is the first main presenting symptom of many patients. So it suggests us some form of arthritis is there to the patient. So this is one symptom which warrants a visit to a rheumatologist, where there is persistent joint pain with swelling of that joint and redness and warmth of that involved joint. So these are all the other signs of the joint involvement, where there will be swelling of the joint and redness of the joint. So if you have any of these symptoms, like persistent joint pains involving multiple joints and swelling of the involved joints with the redness and warmth of the joints, this warrants a rheumatological consultation. And another thing, and another sign, another symptom of rheumatic disease will be the early morning stiffness. So if a patient is having any early morning stiffness, like when the patient gets up in the morning, he's unable to do his daily routine activities as fast as he has done previously, which will be lasting for about 30 to 40 minutes. And this is a sign of rheumatic disease, which we'll call it as early morning stiffness. If this kind of symptom is present, this also warrants you to see a rheumatologist. Another symptom will be that unexplained fever and unexplained weight loss, or any rashes seen on the either lower limb extremities or the upper limb extremities, along with these joint pains. So that also warrants the consultation with the rheumatologist. Mainly any muscle pains, specifically with weakness of the joints, also with weakness in the climbing the stairs and all, with the persistent muscle pains, also warrants a rheumatological consultation. So these are all the basic signs of when to consult a rheumatologist. One being the persistent joint pains, and the other being swelling and redness and warmth of the involved joints, and the other being early morning stiffness, and other being unexplained weight loss, unexplained fevers, and swelling and redness of the joints. These are all the symptoms which will warrant a rheumatological consultation. And another symptom which will be telling is family history of any rheumatic diseases. If a person is having any family history of rheumatic disease or autoimmune disease running in the family, along with these symptoms what I have explained, this warrants an early consultation to a rheumatologist. So what will be the I'll be telling what is the role of rheumatologist in treating these diseases. First, we'll take a detailed history of what are the symptoms of the patient, including the physical examination of the joints involved, and we'll order some investigations which are required to diagnose the what condition we have been suspecting. So we'll order the investigations which are required for the thing, and we'll then interpret of what kind of autoimmune disease he has, whether he has any rheumatoid arthritis or any other form of arthritis. We'll just come to a conclusion, and based on that, we can just start the treatment based on the reports available, based on our physical examination, based on the interpretation of what we have seen previously. So basically, So after seeing the reports, we'll just initiate you on treatment, which will be different for different persons, and which will be different based on the condition of what you will be diagnosing you. If any rheumatoid arthritis is diagnosed, we'll be just starting with disease modifying anti-rheumatic drugs, which are need to be taken for a longer time. It will be based on the treatment course will be based on how early the patient presents, and the treatment will be based on whether the patient has deformities or not, and whether the patient has persistent inflammation in the joints or not. So based on these things, we'll go ahead with the treatment. So this is the main role of rheumatologist in diagnosing with these symptoms and ordering tests and having a physical examination and coming to a reasonable conclusion of what the disease is and starting the treatment. So we have a different modalities of the treatment in treating rheumatic diseases. One, as I said, is the use of medications. The medications being either immunosuppressants or the disease modifying anti-rheumatic drugs, and some supplements to the bone strength we'll be giving, like calcium supplements and vitamin D supplements we'll be giving. So this will be the medical management, and the other management will be the lifestyle changes and the physical therapy of what the patient have to do. The lifestyle changes is we'll advise him to go for a regular exercise and to stop smoking if he has any history of smoking and all. So we'll be advising him to go for an active lifestyle, and with the physiotherapy also we'll be advising you to protect the mobility of the joints and all, the physiotherapy part. So these are the basic treatment options available for the rheumatic diseases. So we'll be guiding you when to start the treatment, how to start the treatment, how to monitor the treatment, treatment related adverse effects also we'll be guiding you once the treatment is started. So treatment should be started as earliest possible to avoid involvement of any organ systems, so that we can come halt to with the treatment we can halt the process ongoing. So this is the basic thing of treating rheumatic diseases. So I'll be summarizing of what I've told. So this is basically, rheumatology is a branch which deals with the rheumatic diseases. We have different set of rheumatic diseases such as rheumatoid arthritis, SLE, and vasculitis, osteoarthritis, gout, and other autoimmune diseases. So earliest possible visit to a rheumatologist helps in diagnosing earliest and treating him earliest and curtailing the treatment in the next visits, so that the disease process comes to a halt. So that is the basic main important thing, to visit the rheumatologist earliest and get the treatment started earliest by observing the signs and symptoms. The basic signs and symptoms, as I've told, mainly will be joint pains, muscle stiffness, early morning stiffness, and any swelling and redness in the joints, any chronic persistent fatigue he's having, any unexplained fevers, any unexplained weight loss and rashes accompanied with this, and any family history of rheumatic diseases or autoimmune diseases running in the family warrants you a visit to a rheumatologist. So after visiting us, we'll be guiding you to, we'll be examining you, taking a detailed history we'll be taking, and we'll be doing a physical examination of the joints, and we'll be ordering a test so that we can come to a reasonable diagnosis. Based on the diagnosis, we will advise you what are all the available medications available, medication treatments available, and what are the lifestyle modifications need to be done, and what are the physiotherapies need to be done, and other things. So this is basically, coming earliest leads to treating earliest and leads to possible curtailing the adverse event effects of any other organ system involvements. So yeah, thank you.